If you're planning retirement before 65, you're probably missing a 5-figure expense. Medicare will not rescue that gap. Here is what most retirement projections skip. Healthcare costs do not begin at 65. They spike before it. In the next few minutes, I'll show the bridge cost, the enrollment traps, and the funding order that works. Fidelity estimates a 65-year-old may spend $172,500 on healthcare. But that headline number distracts people. The bigger threat is the pre-Medicare window. That is where plans break. Leave work at 62, and you may need 36 months of replacement coverage. That bill arrives immediately. Markets can cooperate and pensions can help. One medical gap can still destroy cash flow. That is the uncomfortable math. If retirement calculators made you feel prepared, you are not careless. Most of them understate premiums, deductibles, and timing. They anchor you to portfolio balances. They do not anchor you to monthly healthcare cash flow. That difference matters. And if you feel behind already, stay with me. The next numbers are the ones planners should start with. Start with the rule most people forget. Medicare usually begins at 65. Retiring earlier means buying your own bridge. Here is where it gets interesting. The bridge is not one bill. It is premiums, deductibles, copays, taxes. SOPRA feels safe because it keeps familiar doctors. It lets employers charge up to 102% of cost. KF says average family employer coverage costs about $26,993 yearly. Workers usually see only their share. Employers absorb the rest. Retirement exposes the full premium in one brutal moment. Take Mike, age 62, married, still supporting one dependent son. He leaves a $90,000 job this summer. His payroll deduction felt manageable before retirement. Then COBRA shows the full number. It lands near $28,000 yearly. Run that for 18 months and Mike spends more than $41,000. That excludes deductibles and co-insurance. Then he still needs another 18 months before Medicare. If he guessed wrong, withdrawals rise fast. Sequence risk gets worse. Most people miss this part entirely. The problem is not just cost. The problem is forced timing. Let's run real numbers. Mike spends roughly $27,600 on COBRA for the first year alone. Add a $6,000 family deductible and out-of-pocket costs. The bridge can exceed $33,000. If his portfolio was supposed to fund $60,000 yearly, healthcare alone eats more than half that budget. Now compare Sarah, age 59, single, earning $72,000 before retirement. She assumes private coverage will be impossible. That assumption is usually wrong. The ACA marketplace can be cheaper than COBRA. Subsidies change the math. If Sarah controls taxable income carefully, premium tax credits may reduce premiums dramatically. This depends on income and state rules. In some states, two neighbors with equal assets pay very different premiums. One manages income, the other triggers subsidy loss. So the right question is not, can I afford retirement? The right question is, how will I buy coverage? If that sounds backward, you're paying attention. Retirement is not an age decision. It is a healthcare financing decision. Conventional advice says delay retirement until investments feel sufficient. The smarter move is modeling coverage before picking a date. Behavioral finance explains why people skip this. Present bias makes today's burnout feel larger than tomorrow's medical bill. Your brain discounts a premium next year. It overweights relief right now. That impulse is expensive. Smart planning sounds less dramatic. Run the numbers first, then pick the date. Emotion cannot price insurance correctly. The next trap is assuming Medicare itself is free. It is not. It is subsidized, layered, and full of choices. In 2026, Standard Part B costs $202.90 each month for most enrollees. Part B deductible is $283. Part A hospital deductible is $1,736. Drug coverage adds another layer. High-income retirees can also pay IRMA surcharges on top. So when people say Medicare makes health costs disappear, that is fantasy. Costs drop. They do not vanish. Here's the deeper number reveal. A married couple can misprice retirement by tens of thousands just by ignoring healthcare transitions. Say both spouses enroll in Standard Part B. That alone is about $4,869 yearly. Add Part D, a supplement or Medicare Advantage plan. dental, vision, and ordinary out-of-pocket costs. The annual total can land well above $8,000, sometimes far higher. Your tax bracket changes the result. That means the bridge does not end at 65. It changes shape. Plans fail when people stop recalculating. Another issue is drug spending. In 2026, Covered Part D costs cap at $2,100. That cap helps, but only for covered drugs. It does not make every prescription cheap. Formularies still matter. And it does nothing for hearing, most long-term care, or many dental costs. People hear cap and stop thinking. That is anchoring in real time. One reassuring number crowds out every other line item. Your brain loves shortcuts. Take Linda and James, both 64, retiring this year. Their balance sheet looks strong, their tax planning does not. They sell appreciated stock, realize a large gain, and trigger higher income. Next year, their Medicare premiums jump. In 2026, married income above $218,000 moved them above the standard Part B tier. Part B premium can rise from $202.90 to $284. That extra premium feels annoying, not fatal. Over years, repeated tax mistakes quietly erode flexibility. Quick pause, because this matters for almost everyone here. What retirement age are you planning for? Drop it below. And what worries you more right now? Premiums, prescription costs, or retiring before Medicare starts? I read those comments. Back to the math. The point is not to fear healthcare. The point is to fund it deliberately. If you have not modeled taxes, premiums, and timing together, you do not have a retirement date yet. Here is what behavioral finance research shows. Loss aversion makes people overprotect investment balances and underprotect cash flow. They hate seeing money leave the portfolio, so they ignore healthcare line items until the bill becomes unavoidable. Then they cut the wrong things. They cancel travel, delay care, or claim Social Security earlier than planned. That reaction solves anxiety today. It can lower lifetime flexibility tomorrow. Again, present bias wins unless math interrupts it. This is why a cash reserve matters, not for comfort alone, for decision quality under pressure. A dedicated healthcare bridge fund can prevent panic selling. It can also stop you from claiming benefits too early. For some households, that fund belongs in high-yield cash or short-duration bonds. Safety matters more than extra return. Past performance does not guarantee future results. But cash flow planning still beats improvisation every single time. Now let's talk about the tool pre-retirees underuse. The HSA is not just a medical account. Used correctly, it becomes a tax-advantaged bridge asset. Contributions are deductible, and qualified withdrawals are tax-free. But there is a rule people miss. Once Medicare starts, new HSA contributions generally must stop. Medicare can even apply retroactively in some cases. That is why many people stop contributions about 6 months early. Miss that timing, and you can create an avoidable tax penalty. Small administrative errors become expensive because nobody planned backward. Take Karen, age 64, still working, maxing her HSA. She files for Social Security earlier than expected. Medicare backdates, her HSA contributions overlap, and now she needs corrections. Not catastrophic, completely avoidable. The conventional advice says max every retirement account first. The math says healthcare flexibility sometimes deserves equal priority. A taxable brokerage account has no special healthcare magic. It does offer liquidity without age-based account restrictions. This is where you have to make a choice. Max tax deferral or preserve optionality for the gap. For high earners, the answer is both in order. Capture matches, use the HSA, then build flexible assets. My priority is long-term flexibility. That sentence can save you from a lot of elegant mistakes. Another uncomfortable truth is family status. Retiring early with a spouse below 65 raises the bridge cost sharply. One spouse on Medicare does not solve both lives. Couples often plan as if eligibility arrives together. It does not. If one partner is 65 and the other is 62, you may still carry private coverage for years. Your state may have different rules and marketplace pricing varies widely. That is why generic retirement targets fail. Most painful insight next. The Medicare gap is often largest for people who think they are almost done. They have enough assets to leave work. They do not have enough liquid plan design. Those are different things. $800,000 in retirement accounts can look impressive. 3 uninsured years can make it feel fragile very quickly. And because healthcare costs are monthly, not abstract, they create constant psychological pressure. Pressure distorts good decisions. That is when people accept bad annuities, bad advisor pitches, or bad tax moves. Confusion is expensive. So what does a better framework look like? Start with coverage first, then taxes, then portfolio withdrawals, then Social Security. Price each year from retirement date to Medicare date separately. Do not average the bridge away. That hides the risk. Then price year 1 of Medicare honestly. Include Part B, drugs, supplements, dental, vision, and expected out-of-pocket costs. After that, model taxes and surcharges. IRMAA is not a scandal. It is a threshold problem. Finally, stress test the plan with 1 bad market year and 1 bad medical year. If it survives, trust it. Here's the deeper truth. Retirement freedom is not just having assets. It is having enough clarity to say no. No to panic. No to overspending. No to advice that sounds simple because it ignores healthcare complexity. If this topic overwhelms you, that does not mean you failed. The system is fragmented by design. Medicare has parts, premiums, penalties, enrollment windows, and income adjustments. Of course, intelligent people underestimate it at first. Your job is not mastering every acronym overnight. Your job is building a plan the acronyms cannot ambush. So do one practical thing today. List every year until 65, then assign a healthcare funding source to each. Write down COBRA, marketplace, spouse coverage, HSA, taxable cash, and expected monthly premium ranges. Make it concrete. Then say this out loud. That payment does not fit my plan. Cash flow matters more than this purchase. And this one too. I am not optimizing for today's emotion. I am protecting future flexibility. If you want help, consider a fee-only advisor who will model taxes, healthcare, and withdrawals together. Not just investment returns. Anyone can sell optimism. Real planning survives premiums, penalties, and paperwork. If this gave you a clearer framework, subscribe and stay close. This channel is about better decisions, not comforting myths. And tell me in the comments what bridge you are counting on. SOBRA, marketplace, work, or something else. Smart retirement decisions do not come from fear or urgency. They come from clarity. Run your numbers. Protect freedom.